Welcome to the Moss Report with your host, Dr. Ralph W. Moss.
Hi, this is Ralph Moss for the Moss Report podcast. Today I have a very, very special guest, one of my oldest and dearest friends and colleagues in this field, Ralf Kleef, who I used to introduce as Ralf Kleef of Vienna, Austria, and now I think I have to introduce as Ralf Kleef of Budapest, Hungary. We'll get into that in a moment. So welcome to the podcast, Ralf.
Yeah, thank you for having me. Great to meet you again.
Yes. And I want to just start by kind of recapitulating our history together because it's something very significant in my life and hopefully I think in your life as well. And that was that about more than 25 years ago, I got a call from what I would describe as we call a eager young research postdoc at Memorial Sloan Kettering, and named Ralf Kleef, and he came recommended by a woman named Helen Coley, who was a close friend and colleague of both of us. And I think the year for that was 1994, if I'm not mistaken, Ralph. And you were a postdoc
Correct.
in immunology at MSKCC, which still at that time, 26 years ago, was fairly unusual. People who have sort of just become aware of the cancer field might think of immunotherapy or immunology as an established treatment. But you and I know that at the time it was sort of on the borderline of alternative medicine. It's sort of in between the two. And then after that, we became fast friends and saw each other in Manhattan. We both were living in the New York area at that time. And then you were very instrumental in a group that most people haven't heard of, but that actually had a profound influence over the future course of development of the complementary medical field, and that was POEMS, POMES. Maybe you could describe for us what that was, Ralph.
Yes, POEMS stands for Prospective Outcome Monitoring Evaluation System, called POEMS, and that was called into action by Wayne Jonas. Wayne Jonas was at that time, head of the NIH Office of Alternative Medicine, which was founded by some senators who gave into the pressure of the public that at the NIH, National Health Institute, the largest health institution of the world, there also should be research on so-called alternative medicine. And then Wayne Jonas became the director there. And I remember I came down after my postdoc in Sloan Kettering to spend just a little internship with them for 2 weeks. And out of this came a whole year because Wayne Jonas, he's an MD, he suddenly invited me to say, hey, Ralph, you know the history of fever therapy of cancer. Why don't you head a task force on that? And the first thing he did was that he created this POEMS, and that was a large conference where many experienced clinicians, basically, many of them came from Germany, met in Washington, D.C. for this conference where we tried to outline possible research strategies in outcome research. That means all of us, we are having years and years and decades of experience. And then Wayne was really good in saying, okay, we should be able to learn from this vast experience of decades of clinical application of so-called alternative medicine.
Yes,
and he did a great
I'll
job.
point out to the listeners also that you are German, even though you've been working in other countries, Austria and Hungary now, and in a way, you were an very important link between the American CAM, that's complementary and alternative medicine community, and the German community. And I think it's remarkable how much of the development in this field worldwide was a result of this very creative, productive relationship between Germany and the United States.
Hmm.
And you were, in a sense, the link. Wayne, most people don't realize, although Wayne is American, he grew up in Germany. He is fluent in German, and he is very cognizant of the important uh, position that Germany holds in the world of complementary cancer treatment. So I think, there was this. It was more than coincidence. I think it was a very vital role that you played. Plus, I mean, we'll talk about Coley's toxins, but for many years, the Coley concept, the fever therapy concept, was um, survived in the world because of Germany. And also, of course, Coley didn't know it, but actually, the use of fever causing bacteria, specifically Streptococcus, had actually been discovered in Germany, unbeknownst to him. So it actually, there are these constant back and forth between Germany and the United States over these core concepts of that we now call cancer immunotherapy.
Right, right.
And so, yes, we had a lot of contact around that POEMS meeting, and then around the Office of Alternative Medicine. I was, as you remember, a founding advisor to the office.
Hmm.
We were on staff under Wayne Jonas, and then you went back to Europe, and I remember, and you decided to settle in Austria, and maybe you could describe that, why you went to Vienna, and what that was like.
Yes, I fell in love with Vienna during my medical studies. I spent the year number 5 of my medical studies in the city of Vienna. And from there, I went to London, and from London, I went to the Biomed Clinic in Heidelberg, and then I went to Sloan Kettering. And when I finished my task with the OAM, the Office of Alternative Medicine, which actually now is called OCCAM, Office of Cancer Complementary and Alternative Medicine, I realized that the country of Austria had nothing to do with hyperthermia, whereas in Germany there were 20 or so clinics and practices doing hyperthermia. And that's when I had the idea, why don't you go to Austria? And against all people who said, oh, this will never work, I established a small hyperthermia clinic. And now we are very, very happy and also a little bit proud that after 22 years in Vienna, we can say that we founded the largest private outpatient department for integrative oncology in the city of Vienna, Austria, and also in the whole country. Let me say a quick word on the word alternative. Um, During my postdoc time in Sloan Kettering Cancer Center, I had a very harsh, brilliant immunologist. His name was Dana Bothberg, and he worked in the department of Jimmy Holland, a world famous psycho-oncologist. And Dana, he was always getting a very red head when I had some of my ideas on alternative medicine. And he said, Ralf, this is an hypothesis. Can you prove it? Go down to Cornell Library and read it up. So this was a tough place. But then I, through the help of Helen Coley, who was the daughter of William Coley, got a stipend from the Cancer Research Institute. The Cancer Research Institute was founded by Helen Coley and Dr. Lloyd Old, who became the scientific director. And so I grew quite close to Lloyd. I mean, he was a famous immunologist. He discovered, together with Betsy Carswell, the tumor necrosis factor in 1974. And he once told me, Ralph, there is no alternative medicine and school medicine. There's either good medicine or bad medicine. And it will never, ever forget it. And he also told me a good scientist tries to prove himself wrong.
Right.
So through all these years, I was always a little bit skeptical towards my own approach. I never was a so-called true believer, and I had I had the eagerness to say, okay, if something works, we have to prove it. We just can't go on with it and not document it. And that, of course, in the science of medicine is done with prospective clinical studies. First, you go into the laboratory, then into the animal experiment, and then you make your phase 1, 2, 3 studies. And so the lowest level of clinical evidence is a case report. And that's what I've made. I made case report after case report after case report. And of course, normal oncologists would say, this is just a case. But I think we have to not forget that a case is a case, and if it's fantastically documented, and you have dozens of cases, you should start thinking, maybe something is really onto that. And I have to thank Lloyd Alt for doing this. But let me briefly go back to the very beginning, how I found Helen Coley. Can you imagine there was a time on this planet when there was no internet and there was no mobile phone? This was a time where you still had a yellow telephone book. So I came from Germany to New York City in 1994. I couldn't believe how high the skyscrapers were. I was always looking in the sky, looking up. It was unbelievable. And I got the yellow telephone book and I looked up the name Helen Coley because I had met fever therapy with bacterial vaccines of cancer in the first clinic which ever used hyperthermia in Germany, the Biomed clinic of my wonderful friend and master teacher, Dieter Hager. And then I thought, when I'm in New York, why don't I look this woman up? Maybe this is an interesting encounter. That's all what I thought. And I found her in the telephone book. I rang without a handy. This was a normal telephone. Introduced myself, and she invited me immediately to visit her in her huge, little bit run down, wonderful old Park Avenue apartment, and we clicked immediately. And it was her who said very soon, there's somebody you have to meet, and that was Dr. Ralf Moss, and that's how we met. And of course, Ralf Moss and I, we also clicked immediately. So I think that's a very happy story behind all that.
And one can't overstate the importance of Helen Coley in the development of immunotherapy. And we've done a film. My grandson Jacob did a film this year called Immunotherapy: The Battle Within, and we give full credit and reference to these three individuals on whose backs everything rests in terms of the modern development of immunotherapy. And that's in our day, Helen Coley and Lloyd Old. And then before them, the previous generation, Helen's father, William B. Coley. So in a sense, both of us, intellectually speaking, are the grandchildren of William Bradley Coley, who was at Memorial, the precursor of Memorial Sloan Kettering, from the 1890s until his retirement in 1933. And then, of course, the tradition continued with his son, Brad Coley, and then more importantly, Helen, his daughter, of his, later in his life, who continued until her death in 2000. So we're talking about an intellectual heritage that goes back over 100 years. In my conversation with James P. Allison, who succeeded Lloyd Old as the scientific director of Cancer Research Institute, he pointed out to me that Coley, to his knowledge, never used the word immunotherapy. Coley was an empiricist. He just simply observed that, it's not simply, but he observed that people who got fevers associated with two particular bacteria oftentimes would, if treated correctly, would have remissions of their cancer. But he was not associating that with immunotherapy. That really was Lloyd's contribution and Helen's contribution. I think they were the first ones to understand that what Coley did was a kind of immune therapy.
Yeah, Dr. Helen Coley is credited with saving the life work of her father, who over 40 years um, developed and employed fever therapy for cancer on
Yeah.
on a typewriter. This was before the internet age. She typed 13 monographs, each of them containing more than 1,000 literature references. And for that work, she was honored with a honorary doctor from Rockefeller University later in her life. And I will never forget how one time she also was honored by the prestigious University of Lund in Sweden to give a talk on her life work and the life achievement of her father. And then she told me, "Young man, you're coming with me. You'll be my bodyguard." So I flew with this in a late 70s lady all the way to Sweden, and she gave a stiff talk there to a big scientific audience.
Yeah.
And it was a company called Pharmacia inviting and hosting everything. And then I remember Thierry, his name was Thierry Calland, the director of pharmacy at that time, and he told to Helen, tell me way how we can patent your bacteria and we will start producing them right away. So it was all about money at that time also.
Oh, yeah. And then she also, at that point, made contact with Johann Haux, who was
Yes,
MD,
yes,
PhD, and like you, uh, she's in her will. She sent a lot of her personal documents to you and to Johann to sort of keep the momentum going, which I think is very touching because I had the same experience with you and with Johann of sort of taking me to the basement to see all of Helen's papers, which are, in different places, as obviously, but she had a profound effect on many, many people. And she was a very good influence in terms of Lloyd in keeping him focused on sort of the alternative aspect of this, namely that there was another way of treating cancer, which he knew, of course, but she was an activist. Lloyd was kind of very quiet and reserved and a little fearful of antagonizing the establishment, and Helen was a firebrand. So yeah, this is a wonderful background. So, and you and interestingly, Ralph, I mean, at so many points, you seem to sort of connect up with the real leaders of the field. You were attracted to them, and vice versa. And just say a word about Dieter Hager, the founder of the Biomed Clinic, which still exists. He unfortunately passed away about 10 years ago, but tell us a little bit about him, about Dieter Hager.
Yeah, Dieter Hager was an MD, PhD. He was a medical doctor and a physicist. And he was the first who actually brought the idea of hyperthermia to Germany. He opened the very first clinic, and this was in 1989. I joined this clinic as a young doctor in 1991, and I originally I wanted to become a radiation therapist in radiology. And then when I entered that clinic, the spirit there, what they practice, this integrative holistic oncology, including mistletoe treatment, whole body hyperthermia, local regional hyperthermia, weekly, daily workshops on nutrition and meditation and counseling, the importance of our feelings and thoughts in the healing process. Metronomic lower dose chemotherapies, intraperitoneal hyperthermia, all this rose my interest immediately. And after 3 weeks, I decided to stay there, and I stayed 3 years and did my intern in oncology there. Dieter was a true leader, and he had a real big task ahead to form the Society of Biological Cancer Therapy. Without him, I think the German movement of integrative oncology, specifically with hyperthermia, never would have happened.
Yes. And he was a wonderful person and a very, very idealistic person who had studied at Oxford University. I think he had his PhD from there. Just an
Yeah,
amazing.
MD, PhD, yeah. And he was also a part of the poems. Wayne Jonas back then told me,
Yeah.
get the best people in the integrative medicine field from Germany and bring them all over. And so, of
Yes.
course, my old boss was my first choice.
Yes. Just great person and a great thinker, and we wouldn't be where we are without him. So now I want to shift gears a little bit, Ralph, and I think of you as I said earlier, Ralf Kleef of Vienna. Now you are moving your lock, stock, and barrel, as we say, moving your clinic due east to the other great city in that region, which is Budapest, Hungary, my mother's native city, and um, and so I want to hear about that. Tell us about the clinic and what's behind the move. Why did you decide to leave a beautiful facility that you had in Vienna and go to Budapest? So what's behind it?
Love. It's love. It's love towards my wonderful Hungarian wife. She is a nurse, like you only could dream of a nurse. She puts herself in front of a patient, and many patients are eaten up by their fear. And Christina, with a big, calm brown eyes, stands in front of the patient and makes a movement with her hand and says one thing to the patient: everything will be good. And you can feel how the fear is dripping down from the patients and vanishing. And this woman came into my life 12, 13 years ago, and she understood, being a nurse, immediately the idea of immunotherapy and integrative oncology. And so that, since she's from Budapest and her whole family there, we had the idea, why don't we make a much bigger project there? The good news is that in Budapest we will have a truly big clinic on 8,000 square meter, which also has two operation theaters. It has intensive care unit. It has an MRI and an CT and cardiology, gynecology. We have our own laboratory, our own pharmacy. So this will be the next generation, like from the old Star Trek to the new Star Trek. And we have a there we will have the research facility to do what we really want to do, and also look more into the study. We have started making close ties to the Semmelweis University. One of my co-authors and also a mutual friend with Ralf Moss, Dr. Tibor Bakash, he is already waiting for me to come to Budapest. So I think the whole setting will be much more professional and much broader. And we will be a big group. I'm sure we'll be 50, 60 people working in that clinic. And
Amazing.
and we are going to make the move around Christmas. So in a month's time, 22 years of Vienna will be finishing.
So I just did a little calculation for the American um, audience. So 8,000 square meters is, according to my calculator here, 86,000 square feet. That's unbelievable. I mean,
Yeah, we have, yeah, I said before I will leave this planet, which will hopefully be many, many more decades,
you hope so.
I want to leave my imprint in this field of integrative oncology. And I would like to say this word: we, I mean Ralph Moss and Ralf Kleef and everybody else, we are standing on the shoulders of a giant, and that is William Biculi, who brought this idea of fever therapy to the world. And I think we have now the chance in the era of immunotherapy to really make the world, the scientific world as well as the layperson world, listen to the importance of what Cooley had found out.
Amen. Amen. And the world doesn't yet realize what the foundation stone is of this amazing development. I mean, we know that Jim Allison and his colleagues got the Nobel Prize 2 years ago for the immunotherapy, but I don't think that the world as a whole quite connects up the work of this towering genius, William B. Coley, with modern day developments. They just give these immunotherapy drugs without really much understanding, because you have to, in order to really do something right, you have to understand the history of it, right? So we'll get into that in a moment. But
Yes.
good luck with this clinic. I can't help but remember, Ralph. Um, there was a period of time in the late 90s where we sort of lost touch for a while. And then I ran into you at the German Oncology Society meeting in Baden-Baden, Germany. I don't know if you remember this. And we were
Mhm.
walking in opposite directions or towards each other in the promenade, in the famous promenade in Baden-Baden. And then we kind of recognized each other. And you said, come to Vienna and see our setup. And I said, well, how many beds do you have? Because most of these clinics, like Biomed, had like 100-bed hospital, right? And you very very charmingly said, well, we only have one bed at the moment, or something like that. So, I mean,
A
it was
long time
a
ago.
long time ago. So it was like this little, and then I came, all right, and it was a very nice clinic, but very small clinic. So the rise of the Kleef clinic is phenomenal. I mean, how you've gotten from that little one bed hospital, as it were, one bed clinic, to this 86,000 square foot facility is just amazing. And I think it's indicative of the rise of immunotherapy within the field of oncology. So good luck with that. And I'm sure many people listening to this will wind up going to your clinic. And you stand on the shoulders of Coley, of Helen Coley Nortz, of Lloyd Old, and of Dieter Hager. You couldn't have a better intellectual background if you invented
Yeah.
this for fictional purposes.
I feel very, very blessed and honored to do that work, what I'm doing,
Yes.
honestly. And I think it has a very, very big significance. Let me briefly elaborate on the topic of fever and cancer. I wrote a small book in German about it. It's called Hot Truths, and that is, if you ask 10,000 cancer patients, "Hey, when was your last fever?" The overwhelming majority would say, "Fever, I have no idea what you're talking about."
Mhm.
So, and that was something what I shared with Helen also, that in our society we are losing the ability, starting with the childhood, to develop normal fever for three reasons. One is that every mother stupidly suppresses fever with paracetamol or ibuprofen or aspirin because they think fever is bad. Number two is that practitioners very, very often and much too much give antibiotics because they think they must suppress a fever with an antibiotic treatment, whereas very often it is a virus. And number three, I think that also multiple over vaccination of the little children can also block the immune system for further. So I think that what we have to understand is that fever is a natural environment where our immune cells, specifically the T cells, but also the natural killer cells and dendritic cells, are acting the best. And if you think about it, what is fever and how it's developed in nature, it comes in cycles. It's not that we break a fever of, let's say, 104 Fahrenheit and then we are having that temperature for 5 days in a row. This would have extinct our species. So God was very clever to develop the septic curves. Shoot it up, then let it drop down, shoot it up again, let it drop down. And that is exactly what we are deploying in our therapy. We are imitating nature. We believe that the modern immunotherapy, which is called checkpoint inhibitor therapy, needs the addition of a fever-like induction with endogenous and exogenous hyperthermia. Exogenous simply means that you are making passive whole body hyperthermia as like a training effect, and there's a huge scientific tradition, specifically in America, to name Joan Bull or Elizabeth Raparsky at MD Anderson, Texas, or the
Roswell.
Roswell Cancer Park City in Buffalo, New York. And the endogenous fever therapy, of course, in the old days was Cooley, Nowadays, it's close to impossible to obtain good coolie vaccines. I recently heard about um, a laboratory in New Zealand. They approached us, but we're not sure about
Yeah, they're shut down now.
the
They were shut down.
okay. Yeah, because it's all about the legal situation, whether we can employ it. And then, I can briefly mention that we discovered a drug which has been around for more than 30 years, and that is interleukin 2, which is a T cell stimulant licensed for melanoma and kidney cancer. And we discovered a fascinating side effect, and that's fever. And so what we developed is a protocol where we give the checkpoint inhibitors in lower dosages, and I will briefly say why we give lower dosages, and combine that with hyperthermia. So the key is synergy. This is not
Yeah.
either or.
We would like to take a moment to thank our Patreon subscribers for helping to make this program possible. If you would like to have access to exclusive content, including transcriptions, episode recaps, and special offers, become a patron today at patreon.com/mossreports.
Now we're going to make another pivot to discussing the recent paper that just was accepted and published in an outstanding immunotherapy journal, summarizing your work. But I wanted to just give an analogy. It's often said that in conventional literature that the immune checkpoint inhibitors release the emergency brake on the immune system, which is a good analogy. That's a very good
Mhm.
description. But as we know from automotive experience, just releasing the emergency brake on a car doesn't make the car go. And unless you live in San Francisco, in which case it may go out of control. But if generally speaking, if you want to get somewhere, you're going to release the emergency brake and you're going to step on the gas. And so
Yeah,
that's the way in my simple way,
and
I can see.
that's a very good explanation. So, and the gas is a fever.
Correct. The gas is the immune stimulation. So it isn't enough to say to the immune system, now we have relieved some of the inhibition of the lymphocytes, the white blood cells that the cancer is causing. We're also going to activate those white blood cells and multiply those white blood cells, the lymphocytes specifically, particular kind of lymphocyte that they call a activated lymphocyte or a tumor infiltrating lymphocyte or a natural killer cell. These are the cells that do the dirty work, do the killing of the cancer, and so you have to have both. And there is a little bit of a recognition of this from the two of the top leaders of immunotherapy, academic immunotherapy in America, and that's James Allison and Jed Wolchuk at Memorial Sloan Kettering, because they co-authored two papers in which they proposed the combined use of immune checkpoint inhibitors with Newcastle disease virus vaccine. Very interesting, right? That they would pick on that particular thing that's so characteristic of complementary or clinics in Germany, but maybe it's coincidental. But in any case, they seem to be recognizing, at least in their papers, the fact that you need to also stimulate the immune system while you're freeing up the immune system. So
Hmm.
this was just a couple of years ago. I think
Uh-huh.
2 years ago that they published this, um, and this is very very important. But now if I can make this other transition, I want to talk about the study that summarizes your past 5 years, 4 or 5 years of
That's
experience
six years. Yeah.
using this modern form of combined immunotherapy, uh, which combines low doses of standard approved immune checkpoint inhibitors with, as you say, the perfectly legal use of an immune stimulant, interleukin 2, and hyperthermia. in treating cancer. So talk a little bit about how that works. What does that protocol look like?
It's very complex. It's nothing easy to be done. The patient, and it takes quite a bit of dedication from the patient, because it takes many, many weeks of treatment where we condition the patient to experience something what they, as I just said, never had in decades. We believe simply giving checkpoint inhibitors alone can, in the classical dosages, lead to severe autoimmune side effects. The current literature says that about 25%, that is a quarter of patients, develop WHO grades 3 to 4 side effects. And that means you often have to be admitted to the hospital. You need high dose corticosteroids. And so what we did, we did the lower dosages, and then, of course, everybody said, this cannot work. And Tibor Bakash and Shimon Slavin from Israel were the first, together with Ralf Moss, to publish on the idea to use low-dose checkpoint inhibitors in the adjuvant setting, in the secondary prevention of cancer. And then I ran into a surgeon from Ireland who published years ago, in 2006, a paper that the co-administration of amino acids called taurolidin would greatly prevent or abrogate the severe side effects of high-dose IL-2. And I met this gentleman in Switzerland, and I asked him, what do you think if I had a setting where we could, in a legal way, in the named patient program, use this drug as a fever inducer? And he said immediately, that's a very good idea, go for it. So I, who never had used IL-2, dared to use that drug. And we used that in the very first patient. That was a real breakthrough, I think, was a patient from London who had triple negative breast cancer, which is amongst the most dangerous breast cancers, but also amongst the most immunogenic breast cancers. And we did a protocol where we gave lower dosage of checkpoint inhibitors combined with local regional hyperthermia, whole body hyperthermia, and the fever-inducing IL-2 treatment. And it was really breathtaking. After 2 months, this disseminated lung metastasis, her lungs were white, full of snowballs of these metastases. It went better. She got better, and she clinically also got better. She was close to dying when she came. After 4 months,
I saw those X-rays, and I'm not
after 4
I'm not
months,
an
she was really back to normal.
You
And
couldn't
after
see normal tissue in her lungs. Am I right?
right.
You know,
So
it was
and
dramatic.
then we have made that experience with a variety of cancer types: esophageal cancer, Hodgkin lymphoma, melanoma, renal cancer, colon cancer, breast cancer, and that when we decided, okay, let's take a better look at that, and we employed some scientists in cooperation with the University of Vienna, and we entered all data into a very professional clinical database management system called Dendrit, and we retrospectively evaluated our cases, which is allowed because I can look at my own data, and we worked, I think, 1.5 years on this evaluation. Was a big thing to do, and we finally got it published, so we can show now that in stage 4, which is normally a very advanced stage of cancer, we can show dramatic remission in about a third of the patients. A third is a lot. Normally in stage 4, it is not as good. It is way below 10%. So I'm very, very happy to see what we are seeing here. And we are continuing this with patients with lung cancer, with head and neck cancer. Yeah, I had one case, an amazing case. This was not a stage 4 cancer, but it was a huge tumor of the vocal cord, and was a young guy. He was 40 something. He made his story public, so I can mention his name. He has a thing on the internet called Michael Cancer Free, and he said, "I don't want to take my throat out because then you cannot speak anymore." And the suggested radiation also with 70 gray would have destroyed his ability to swallow, to have saliva, to have taste. So he may have been cured, so to speak, with classical medicine, but with with devastating side effects. And then they told him in the university clinic, you have 3 to 4 weeks to live because this tumor was narrowing his airways and he was breathing like this. He didn't have air anymore. And I took this big risk on my shoulders to say, okay, let's try this. And I told them there will be swelling of the tumor because millions of lymphocytes will be infiltrating your tumor area. And believe it or not, it got even worse. So we were really always close to when we have to send him to emergency tracheostomy, make a cut in the throat. But this guy was so amazing and said, everything will be good, like my wife always said, And he made it, and now for 2.5 years he's completely cancer free. That's why his blog is called Michael Cancer Free. It's just and to do this is against the whole medical community. Everybody's putting a finger on you and saying, why you're crazy, why you're doing this. But I'm doing this because I really want to help these people, and I take the risk. If I didn't take the risks, we would never develop this field.
Absolutely. And you definitely, I know, having watched this development closely, you definitely put yourself at considerable personal risk to do this. But then again, so did Coley, so did Helen, so did Lloyd. This is what it takes. Unfortunately, that's the way the world is, and people are very resistant to new ideas, and in a way they have to be, because if every new idea was suddenly greeted with open arms, then we'd have complete anarchy. So we don't resent the fact that our critics are rigorous, their demands are rigorous, as long as they're reasonable. But I think what really bears discussion here is that there's innumerable alternative complementary clinics out there that make claims for the efficacy of their treatment. But if you want to talk about clinics that have actually achieved publication of a peer review article on an intent to treat basis of all their cases in a given period of time, the list shortens considerably. I honestly, just thinking off the bat, I don't think there's another one, Ralph. I don't think there anybody. I can't think off the bat. I mean, there have been audits done.
And speaking about studies, let's not get political, but Donald Trump did one great thing for cancer patients. He signed the Right to Try Act, which means that he said, I don't want that my Americans need to travel to Europe to get these innovative cancer treatment. We want to offer that here in the United States. And I'm serious. I want to do what the Right to Try Act involves. That means we will have to contact the FDA and say, look, here we are. We have an innovative treatment. We want to make a phase 1 study where we simply show the safety of the situation, of the treatment approach. And this probably doesn't take more than 40, 50 patients. And this can be done within, I think, maximum 2 years' time. And when we have that, we have the possibility to open the field to much, much bigger endeavors. Then we could go over there and find investors who would say, okay, let's put this treatment into a more larger scale. Let's do bigger studies, because in the end, the scientific community will only believe us if we are able to do the studies.
Well, thank you, Ralph. This has been incredibly enlightening, and there's so much more we could say about this. We will provide a link to the paper that summarizes your results, and I think people will be quite surprised to see how rigorous this is. That people should know that the journal that this is published in, Cancer Immunology, Immunotherapy, is one of the leading journals in this particular field in the world. The editor-in-chief is at the Mayo Clinic, and so it is completely reputable. Been through the peer review process, which was lengthy. It really took about a year and a half, I think, from the time you started the study to the time that it actually got published.
Yeah.
Kind of fast in the world of academic publishing, but it is a landmark achievement. So congratulations for this, and
Yeah,
thank you for
and I want to thank Ralf Moss for this absolutely fantastic work to support and educate cancer patients on what's out there. You don't know how important you are to so many patients, who have a unbiased source of a wealth of information. And I really am. I feel honored to be your friend and your comrade in arms, Ralph. Thank you so much for
Thank you,
everything.
Ralph. The feeling is mutual. For Moss Report, this is Ralph Moss.
Thank you for listening to The Moss Report. Visit our website at themossreport.com and subscribe to hear more discussion of cancer treatment options, alternative research, and more. For more information about Dr. Moss and his work, including scheduling phone consultations, go to mossreports.com.